And now to the pandemic and the UK reporting a record infection level. The latest figures estimate nearly 5 million people in Great Britain have the virus right now. Put another way, that's 1 in every 13 people. Dr. Monica Gandhi specializes in infectious disease. She's a professor of medicine at the University of California, San Francisco. Dr. Gandhi, thanks for being with us tonight. So the UK has reached this record number, 5 million people. Typically, it comes here to the US, right? Like about 4 to 6 weeks later. What should we know?
So this is likely the BA.2 subvariant. It is, which is the other subvariant of Omicron that's more transmissible. The UK now has no restrictions on its population. Importantly, they actually stopped giving out free tests to the public as of April 1st. So there may have been a lot of testing going on. They're now going to only restrict it to NHS, National Health Services, and people who are very vulnerable. Their hospitalizations, luckily, they just reported are 55% incidental, and their death rate has not gone up very much at all. So their hospitalization rate has gone up, but it's 55% with COVID, not for COVID. So we're seeing kind of the pattern when we get to a highly vaccinated place with a new variant that's more transmissible.
So is this the new normal, new variants all the time, but maybe less severe, more contagious, less severe?
I think so, but I hope we don't keep on getting variants. But the WHO gave out a very nice pandemic preparedness plan that really laid out 3 scenarios. They said it's time to exit the emergency phase of the pandemic because we have the tools. And they laid out 3 different phases. One is base phase, where we are now, where yes, BA.2 is the latest, it's more transmissible, but a lot less severe disease. And because we have so much immunity and we need to figure out who to boost, who to give that 4th booster to. In the UK, they're doing over 75. Second scenario, we get a less virulent variant that's more transmissible next. We won't need to boost anyone but the vulnerable. And third and worst case scenario, if we get a more virulent variant, we would need to boost everybody, actually, because the vaccines still work against variants. We just need a boost. And we may even need different types of vaccines.
Okay, so now there's a new variant, XE. Great news. That's even more contagious than BA.2, I was reading. What should we know about this one?
So it's not yet taking over. BA.2 is, it's already 30% more transmissible than BA.1, and BA.1 was the most transmissible variant Omicron we've ever seen. So let's hope that XE doesn't take off. That would still go into the category that the WHO placed as baseline scenario or a more transmissible but not more virulent variant, at least that we know so far. So the worst case scenario is, again, if we get more virulent and more transmissible. Hopefully it won't occur for a long while. And we're seeing deaths go down across the entire world, which is why the WHO is taking us out of this emergency phase and saying we have to live with these variants and understand that we have the vaccines and therapeutics to combat this.
So what are you telling patients? I mean, a lot of us are, the vaccines, I think, are waning. What are you telling your patients about getting this booster?
So the 4th booster in the United States has been approved for 50 and above. That's a little of an outlier because in every other place it's much older. And actually Pfizer only asked for over 65 and above. So the FDA went kind of above even what the drug company was asking for. Most countries are only boosting older people, over 70 in Sweden, over 80 in Quebec, over 75 in the UK, over 70 in Germany. I would say anyone 65 or above should get that 4th booster, which is what Pfizer asked for. I don't see the 50 to 65-year-old data. In fact, there was a study from Israel that younger people who got a 4th booster, no benefit over the 3rd booster, and they were below 65.
Interesting. All right, Dr. Gandhi, thank you. It must be kind of confusing for you, too, in terms of getting all this new information and medical advice. But we appreciate your advice. Thank you.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.